Welcome to another episode of the Experience Better video podcast series. I'm Josh Beekler, physical therapist.
I'm Adam Leese, physical therapist.
So today, Adam, let's talk about manual therapy, putting our hands on people. We do that quite a bit. And what are some different tools or devices out there that maybe can help us help people?
Sure, absolutely. So we think of manual therapy, and like you touched on it, it's any time you lay your hands on the patient. So it's different than like showing them how to move through exercise or something like that. But we're trying to improve range of motion, decrease muscle irritability or the trigger points, and then just trying to get them to relax so that way we can work on strength, improve range of motion, whatever our objective is.
Very good.
But there's one of the main tools that we use. The big one you hear out there is Graston. It's a class that you have to go through. You have to get certified to use their Graston tools. They're pretty expensive. It would be similar to like a name brand prescription drug.
Sure.
There's different off brands, I guess, if you will, out there, and you can go on Amazon, find them pretty easily.
Right. So it's all part of like a larger system, and what's that called?
Yep, and that'd be instrument-assisted soft tissue mobilization.
Right. Yep.
And so the ones that we use here, there's a couple different ones, and depending on what clinic you go to, they might look a little bit different. But we just have the half moon one. It's nice. It's got a little bit of a beveled edge on one side, a little smoother on the other, just kind of depending on how aggressive you want to be. And that's what's kind of nice is you can modulate force a little bit easier with the tool. It saves your hands is a big thing for the clinician, for the therapist. And then obviously you got like the point end here, and so you can get as aggressive as you need to be, kind of get in a little bit of the nooks and crannies. But there are other tools out there. There's some that have like a little J hook that you can get real aggressive with. There's other ones that are like more of it's almost like a triangle bar that works good for the upper traps. That way you can get both sides at the same time. You can use them for quads or hamstrings, calves as well. But the main thing that we use them for here in the clinic is either low back pain, just trying to work on soft tissue mobility. It's not a massage, but it's similar to a massage. Obviously, the massage, there's tons of different types of massages, mainly make you feel good. These ones, our main objective is increasing blood flow to the area, trying to calm the whatever muscle we're working on, calm it down, so that way it's at a lowered state of arousal.
Right.
And then that way we can either progress into strengthening or progress range of motion, or just overall decrease levels of pain.
Right.
Sometimes it helps with other manual therapy techniques such as like joint mobilizations, where if you're working on the spine, you're just kind of pressing on the spine, not necessarily trying to get it to pop, but just getting those segments moving a little bit. Same thing with the shoulder or the neck as well.
Right.
And so it just helps with increasing range of motion, obviously decreasing pain, decreasing that tightness that's up throughout the muscle.
Sure.
Whichever group you're working on.
Well, it's another great tool that we have in our tool bag to be able to help our patients. So, that's great. So, I have a funny story this week. So we recently moved, and we don't have like blinds or shades up yet. And our 9-year-old daughter is hasn't quite totally understood what that means, or for herself, especially when she gets out of the shower and she's marching around in all her glory like she tends to do. So we've had to give her a little bit of a lesson in understanding that people walking by can see you, and she's not too concerned about, but we're like, we don't want the neighbors, the new people, to think that we are a bunch of whatever. So that has been that's now my newfound number one priority. It moved up the list as far as what things I need to get done is get blinds up, get curtains up. So
Definitely.
But well, thanks for tuning in again with us today, and we'll see you next time.